Dr. Esma, today we're diving into something people think they already understand, but absolutely don't. SWICA Zahnarzt coverage hides a few twists that even seasoned patients miss. And trust me, once you hear fact #3, you'll start questioning everything you assumed about dental insurance.
Rasim, you're already stirring suspense. But you're right. Most patients don't know the difference between what's covered, what's partially covered, and what's shockingly excluded. And when they finally learn the truth, they usually say, Warum hat mir das niemand früher gesagt?
Dr. Esma, here's the funny thing. Everyone assumes their coverage works like a magic umbrella. They walk into a clinic thinking, SWICA will handle it, right? And then boom, reality hits harder than a cold air blast during a cleaning. The gap between expectations and what's actually covered is wild.
Rasim, I see this every week. A patient comes in for a simple check, totally relaxed. And when we review the coverage details, their expression shifts from calm to confused. It's never their fault. The fine print is tricky, the terminology unclear, and nobody tells them what risks they're actually carrying. That's why these 5 facts matter so much.
Dr. Esma, this matters because people don't just face surprise costs, they face surprise decisions. Imagine thinking a crown is fully covered, only to find out it's treated like a cosmetic upgrade. That shock alone can derail someone's entire treatment plan. And honestly, nobody deserves to make health choices under pressure like that.
Exactly, Rasim. I remember a patient who came in confident about her insurance, expecting a smooth visit. But when we reviewed the plan together, she realized only preventive care was fully included. The rest fell into gray zone she had never heard of. If she had known earlier, she could have planned calmly and avoided stress. That's why understanding these 5 facts empowers patients more than they think.
Dr. Esma, before we reveal the really shocking parts, give me a little background. Because I read a recent survey that said nearly 60% of patients misunderstand at least one major element of their dental insurance. Well, that's wild. Imagine walking into a clinic with confidence, only to realize your plan isn't the superhero cape you thought it was.
Rasim, that statistic doesn't surprise me at all. Last month I had a patient who thought her entire root canal would be reimbursed because a friend told her so. When we checked the policy, only the preventive exam was included. The look on her face said everything. If she had known the truth earlier, she could have planned better and avoided unnecessary worry. That's why clarity matters more than people realize.
Dr. Esma, from a scientific angle, dental coverage seems simple, but the biology behind treatment certainly isn't. A tiny cavity can turn into a nerve issue faster than most people expect, and the insurance layers don't always keep up with what modern dentistry recommends. That mismatch alone feels like a plot twist nobody asked for.
Rasim, exactly. Scientifically, we know that early intervention prevents complications, yet many insurance models are built around outdated assumptions. For example, inflammation in the pulp can escalate within days, not weeks, but some plans classify essential treatments as elective. This gap between science and policy confuses patients and delays care. Understanding the biology helps people see why coverage clarity is crucial.
Dr. Esma, let's give people a simple step-by-step way to avoid all this confusion. Because honestly, nobody wants to decode insurance like it's an escape room puzzle. If we can turn this into a quick checklist, viewers will feel instantly more in control.
Absolutely, Rasim. Step 1, request the full coverage sheet from your insurer, not just the summary. Step 2, cross-check preventive, restorative, and emergency categories. Step 3, ask your dentist to highlight which treatments fall into which boxes. Step 4, confirm reimbursement percentages before scheduling anything. And Step 5, review updates annually because policies change quietly. With this structure, patients make decisions confidently instead of guessing.
Dr. Esma, now we've got to talk about the classic do's and don'ts, the little things people overlook that cause the biggest headaches. Because honestly, one wrong assumption can snowball faster than a cracked filling spreading under pressure. Let's give viewers the red flags they should never ignore.
Great idea, Rasim. First, don't rely on verbal promises from anyone. Always get written confirmation. Second, don't assume similar treatments share the same coverage. They often don't. And here's a big do. Always ask your dentist to outline cost scenarios before booking. Another don't. Never skip preventive checks thinking it saves money. It usually backfires. These small habits keep patients safe from unpleasant surprises and help them stay fully informed.